Hi, I am Camila SACCHELLI Ramos, and I'm here to present the work Influences of Social and Environmental Factors on Dengue Fever Epidemiology in the city of São Paulo, Brazil. This work has been developed with my colleague, Professor Mônica Ponslouro, and our undergraduate student, Karina Takegan. Here in Brazil, the control of dengue fever has been mostly associated with the control of the Aedes vector. Although we know that it has not been enough to prevent pest outbreaks, we certainly believe that it is an important measure for the disease control. Considering the variety of possible mosquito breeding sites inside a metropolitan city as São Paulo, we wonder if there were other factors that could and should be considered during the elaboration of action plans for dengue fever. In this work, we have investigated the association between dengue fever cases, the prevalence, and demographic density, healthcare infrastructure, vegetal coverage, and favela index. These data were collected from São Paulo City Hall website, where there are open databases, as well as from Rede Cidades. There is an association with movements and initiatives from many cities that are trying to promote social transformation through influencing in political public policies. Our study has collected data from dengue fever cases from 2015 until 2021. We can see here that in the first year, 2015, we had a very high prevalence that has not been seen in the other years. So all the statistical analysis we had taken were from each year, considering the prevalence for each year, as well as a mean prevalence for the whole period. Here we can see in this table the strong coefficient or moderate coefficient in yellow, shown for most of the years, but just for demographic density. A positive, strong or moderate correlation between dengue fever cases and demographic density. We illustrated this in these maps. Here we can see the yellow bubbles showing the subprefectures prevalence. We are considering here the mean prevalence. And then we overlap these prevalence bubbles with the map showing the vegetal covered as well as the surface water areas. And here below, the overlap of dengue fever prevalence bubbles, the yellow bubbles, with the circles, open circles, showing demographic density, showing healthcare infrastructure, as well as favela index. None of this has shown significant association. We are now start to look for another variables. We are looking for the proximity of each subprefecture to water surface areas, as well as the mode of garbage disposal. And we also started a study considering districts that are smaller areas inside each subprefecture, because there were some places, subprefectures, that we could see very different prevalence index comparing 2 or 3 districts inside the same subprefecture. Finally, we are also starting a pilot study considering the installation of adults traps to collect adult Aedes, and we're trying in different locations. We are installing it in different locations, considering vegetal coverage, different density, the demographic density, and close or far from water bodies. And we're trying to collect these mosquitoes and investigate the population during the year, as well as their infection with dengue virus. I want to thank the support, the financial support for our institutional foundation, Mac Pesquisa.